Good afternoon and welcome to today's webinar, Public Health Decision Making During the COVID-19 Pandemic, brought to you by the Network for Public Health Law. I'm Charles Strong, the Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on our website shortly after the conclusion of today's event. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A session towards the second half of today's event. Your moderator for today's webinar is Kayleen Claridge. Kayleen is the Marketing and Membership Manager here at the Network's National Office, and she'll be leading us through the rest of today's webinar. So Kayleen, over to you.
Thank you, Charles. At this time, I'd like to introduce today's presenters. Denise Chrysler serves as Director of the Network's Mid-States Region Office. She also serves on her local Board of Health, Michigan Governor's Public Health Advisory Council, and the National Committee for Vital and Health Statistics, and co-chairs the Council of State and Territorial Epidemiologists Public Health Law Subcommittee. Peter D. Jacobson is co-director of the Network's Mid-States Region Office and Professor Emeritus of Health Law and Policy and Director at the Center for Law, Ethics, and Health at the University of Michigan School of Public Health, where he taught courses on health law, public health law, and public health policy. He has also served on his local Board of Health. At this time, I'll turn it over to you, Denise.
Thanks, Kayleen. Hello, everybody. I'm really pleased to have this large audience today for our webinar on public health decision making during COVID-19 pandemic. And Peter Jacobson and I, over the next half hour, will be presenting a legal and ethical framework to assist public health officials in choosing actions to protect the public health from emerging threats. We'll cover, like I said, a half hour, and this will include 3 scenarios where we will apply the framework to the scenarios. And as you know, public health officials make difficult decisions every day. They need to do so, often with insufficient information, and that's especially true now. They need to decide what to tell the public or what action to take as a threat is emerging. And they walk a tightrope of acting too soon without sufficient or reliable information, or delaying action until they have more information. And while the official may have greater certainty, crucial opportunities may be lost if they delay action, and also others may prove in and fill the vacuum, and this may set in motion a course of action that is not well grounded in science or public health practice. Okay. So good decisions need to be based on timely and reliable data and science. Also, it's helpful when you can make decisions based on past experience, your best practices, policies, and procedures that have developed over time. Unfortunately, today with COVID-19, health officials must make urgent decisions to control a new, highly infectious virus strain that's not been previously identified in individuals. They lack timely and reliable data, especially in the absence of widespread testing. And science, as we know, is a moving target, and it's become very politically charged. So public health officials lack crucial information such as who is infected, who is infectious, how does this disease spread, what control measures work, who has recovered, who's died of COVID-19 or something else, who is immune from reinfection, and what resources do we have, who has them, and how do we get more? In responding to a public health threat, the network has developed these 3 questions that we suggest the public health officials start by asking. First, can I? This is mostly a legal question. Do I have the legal authority to act? Must I? This is also mostly a legal question. Does the law require that I act? If so, must I act in a particular way? Finally, should I? I have the authority to act. The law does not mandate that I act or act in a particular fashion. So how do I exercise my discretion? And the should I involves ethical and policy considerations. First, with a can I. Generally, public health agencies would first look to their state law, the law that establishes their agency, grants power, including to the health commissioner or the health official, the law that establishes standards to guide implementation of these powers, and then the law that provides the means to enforce those standards. So how do I, as the state or local health official, have the legal authority to respond? So do I have the legal authority to respond to an emerging threat? And so what is the nature and scope of my authority? And based on my authority, what are my options? Are there other individuals and agencies that have authority? And this issue of who else has power or who has the authority and how that affects me especially comes in with COVID-19. And that's because, because we have governors very involved now. They've declared a state of an emergency or disaster. They've issued various executive orders to slow the spread of COVID-19. So do I, as a state or local health official, have the authority to impose greater restrictions on movement? Can I issue orders that affect the gathering of people or the operation of businesses? And this will be very dependent on what your state law says. So generally, health officials are entrusted with tremendous powers, but they have limits. Law and ethics say that in exercising the powers, we must consider not only the intended outcome, but also the means that are used to attend these outcomes. For example, health officers must balance their powers and responsibilities to protect the public with personal rights of individuals. And that said, though, individual rights are not absolute, and sometimes they must give way to the good of the community, for the good of the community. So moving on to must I. So whether I'm mandated to act and whether I'm mandated to act in a particular fashion is the issue of must I. Do I have a duty? And while public health has power and responsibility to protect the public from disease and other threats, generally the agency has a great deal of discretion in determining how to fulfill its obligation. And then we mostly get to, and most public health decisions come around the issue of should I, and is based on professional judgment, based on discretionary powers. This involves both policy questions and ethics questions. How should I exercise my discretion? Should I act? How should I act? When should I act? And what should I consider in exercising my discretion to act and the nature of my actions? So this is usually where both state and health officials live. They have power. They're not mandated to act in a certain way, but they have a lot to balance, and there's a lot of trade-offs and competing interests to address in exercising their discretionary power based on their professional judgment. So here's some factors that health officials would consider in exercising their discretionary authority. It's not intended to be an exclusive list. The importance of acting reasonably, being able to explain a rational basis for the action impartially, so that you treat folks who are in similar situations the same, looking at the resources you have, the feasibility of both implementing the action and enforcing the action. What is its impact? How is it? What's the likelihood it's going to be successful? How do we measure that? Will it impact particular, more vulnerable populations? What are our priorities? Proportionality is an issue that is coming up a lot. Some elected officials you've heard say, for example, the cure is worse than the disease. Not all health officials would agree with that assessment, but is my actions proportional to the threat that is out there? And then, of course, we have acting uniformly, acting consistently. What's the strength of your evidence to support your action? What's the strength of your legal authority? Is it nebulous, or is there clear legal authority to support what you decide to do? And what is public opinion? How does that play in? It's going to be pretty hard to enforce decisions if you don't have the public with you. So the importance of educating the public, and for the most part, the public voluntarily agreeing to the action. Political considerations are really presents a very difficult situation now. To what extent are they relevant? For example, what should we consider with regard to intergovernmental relationships and the need to work together? And then finally, on considerations, is just keeping in mind that doing nothing is doing something, and to do a risk assessment and make sure that doing nothing is a conscious choice and not a default. So in exercising discretionary powers, we, of course, have ethical considerations of autonomy and, doing no harm. This is often where issues of privacy come in, restrictions on individuals' liberty, doing good for the benefit of all, justice, how do we treat individuals of vulnerable populations, various other issues of justice. The fidelity, public health is entrusted with a great deal of power. They're entrusted with very sensitive information. How are they faithful to the community's trust? How do they keep their promises with regard to data or with regard to their activities? And then veracity, to be honest, that would include to be transparent. And sometimes these issues conflict in the sense of sharing as much information with the public so that they have a better understanding of what's going on, so that you can address their concerns while trying to protect individual privacy. So the network has developed a tool to assist health officials and their teams in making decisions when threats are emerging or uncertain. And this tool is available on the network's website. It's in the form of a downloadable form that you can complete as needed. You can complete multiple times as situations change. It's intended to ask questions, to look at a potential public health threat, to evaluate the risk of to evaluate risk of acting based on the information you currently know or understand versus waiting to act while obtaining more information to inform decisions. So we suggest you use this tool as a guide to assess the situation, evaluate the threat, consider the options, communicate the risk, and also to record these steps, because you're taking action in a particular point in time based on information you know at the time, and then to assist you in sharing up, to provide situation updates, facts and analysis, the basis for your decisions, and sharing them with other agencies, with your governor's office or your secretariat, and those who have the gift of 20/20 hindsight. So now to go through the tools and then to apply them to some short scenarios we came up with. So first, assessing the situation. What are the facts? And of course, what are the facts we know or understand at this time? Focus on asking the right questions and not assuming the answers, starting at the beginning every time, because you need to validate information you have. It may no longer reflect the current state of data or the current state of what our understanding is of the science of how novel coronavirus plays out. So assume a quick evolution of the facts and the circumstances. Next, evaluating the risk. What are the consequences? We lawyers refer to this as the list of horribles. If the threat that occurs, well, what are the potential consequences? How would this impact on different populations, especially those that are the most vulnerable? And then next, how can the threat be addressed? What measures or mitigation might be used to address each potential danger or threat? Often in addressing public health threats, we can look at what others have done or we've done in similar situations to mitigate the impact or the likelihood of a reoccurrence. That's not as easy these days, although we all are looking to other states, jurisdictions, and what they've done, how that's playing out in their jurisdiction, whether it's being effective, and then building on what each other does. Consider the range of actions and the pros and cons of each. And the hardest is the issue of certainty, whether to act now or wait. What's the potential harm of acting prematurely or in delaying measures or mitigation, and listing the pros and cons of each. What additional evidence would be helpful? What's your time frame to get this? Is there another action we should take while we're considering it, while we're waiting for more certainty? And how do we measure success? What are our resources that we need to execute and maintain the chosen course of action? And then, of course, repeating that not acting should be a decision and not a default. And then when and what to communicate to the public, being transparent, balancing protecting privacy, and then the public's need to know and transparency. So we'll notice to the public of particular information. Will that make a difference? If we're not being transparent, if we're not sharing information, what are the reasons? What's the interest in the public's health? Keeping the public health mission paramount over any political pressure or expediency. And then the shape shift. What would you want to know if you were a resident, if you were a patient, if you were a member of the public, if you were a parent, if you were a healthcare provider? And anticipate the reaction or perception and what could be the legitimate criticism of lack of transparency and delay in lack of notice. And now to our first scenario. This is a scenario that has come up multiple times. We've received a lot of questions about releasing names, addresses of positive COVID-19 cases to first responders. Sometimes the question is about EMS workers, other times it's about police officers and others. So first, the three questions: legal authority to disclose. This may depend on what your law says, but typically public health, even when there are privacy concerns, where there are circumstances to warrant, can disclose information to protect the good of others, to assist where needed in the public health response. There's probably no duty to warn, although there might be some states that have laws that require notification to first responders of exposure to a communicable disease. And mostly this will be best professional judgment. So in the best professional judgment, of course, this is the should I, and there are many factors to consider, including individuals' right to privacy. COVID-19 does have stigma. it does have consequences for those who have the disease and their interest in sharing and controlling that information with those they choose to share it with. But there's also issues of protecting the health and safety of first responders. For example, PPE is in short supply. Does notifying first responders assist them in taking actions to protect themselves and then also in preserving scarce resources? And so weather disclosure, will this protect the general public? Certainly, if you prevent and control the spread of disease to first responders, that means first responders are available and able to respond to the emergency, and it also means there's less likelihood for the first responders to spread the disease to other people. And so the risk about broader identification of individuals or communities, the stigma that is associated with that. To me, though, this really comes down to the bottom line. And this is the question to first responders. What will you do differently if you know somebody has tested positive? And this answer may change over time as we've known more and more about the disease. Now we know that people are asymptomatic who are infectious. We know that people test negative who are infectious. We know that people have mild symptoms and they may look like other symptoms, and there's such a variety of symptoms, it's really hard to know who is infected. And thinking of the world is as far as those who test positive and those who are potential cases. And should those be treated differently? So I think if I were public health, that's what I would want to know from first responders is what will you do differently? I'd also want to, there's a protocol we have on our website from a local health department who is disclosing information to EMS. And for example, to protect privacy and the privacy of those who may never leave transport. The information is being provided to dispatch, not to individual responders, and then individual responders only have access on a need-to-know basis. And with that, Peter, I'll pass it over to you for scenario 2.
Okay, thank you very much, Denise. So we thought that we would reflect political reality for our second scenario and talk about the factors involved in responding to a governor's request to limit or phase out current stay-at-home guidance. As Denise alluded to earlier, governors are facing lots of different pressures. Demonstrators are gathering, sometimes with social distancing, often with not, in protesting the denial of civil liberties with these stay-at-home orders. At the same time, the governors are receiving conflicting information from the federal government, and yet the public is still afraid, and legitimately so, of how lethal the coronavirus is. But let's assume we're in a politically moderate state, so it doesn't much matter, where the governor has issued a broad stay-at-home order that's been in place for about 3 weeks. The governor feels that it's time to move on. It's time to get the economy phased back in and back to normal. But your model, and wants to remove the restrictions now. And however, your models indicate that it's premature. Doing so would only increase the morbidity and mortality implications. As the state's chief health officer, how do you respond? Are you willing to publicly support this removal of the stay-at-home order? So what are some of the factors to consider? And again, as Denise alluded to, this is hardly an exclusive list. But But the governor is really focusing on the loss of business, the continued unemployment. It's clear many states' unemployment systems are unable to handle the tremendous rise in unemployment. We know there are mental health consequences and potentially considerable escalation of domestic violence as a result of the stay-at-home orders. At the same time, you have to be concerned about the potential second wave of the virus, which could be at least as lethal as the current morbidity and mortality statistics we have. Another consideration is individual liberties. People are concerned that they are being unnecessarily confined when they see some of the data receding, that is, some of the case numbers going down. You have to worry about whether the health systems are at capacity and can handle an additional load if you remove the restriction, and we have the testing capacity. There are also health equity considerations. We know that minority communities have been the hardest hit with much higher mortality proportionately in minority communities in their percentage in the population. And as Denise talked about, we are dealing with both science and politics. But if not now, when? When are you going to remove the restrictions? And also you have to think about whether your job is at stake, as we've seen yesterday with Dr. Bright's demotion from his head of vaccines in the federal government. So what do you do? So I think there are two ways of looking at this. If you think that the morbidity and mortality expectations are unacceptably high, remember there's no zero tolerance. At some point, we will open the government and there will be consequences to that. So zero tolerance is not an issue. But if you think that the likely mortality will be unacceptably high, then you can't support it because you fundamentally said, Governor, the costs are too high, even though I understand the economic loss to the state, we're not ready. If you do that, probably you're out of a job. So what's the alternative to that? Well, it seems to me that you should offer your support if there's a plan in place. So what kind of plan might you think about? And we don't have time to go through that, but just let me make a couple of suggestions. One would be a phased reopening using specified criteria. For example, a 14-day period where the new cases continue to decline, where you have enhanced testing capacity, and where you can be reasonably assured that if the models are accurate and you do have a spike in cases, then there's hospital capacity to handle that. Second, the governor has to continue to emphasize the need for social distancing. And third, the governor has to be willing to say, we will impose additional employment responsibilities to protect the public safety. For example, all people entering a business must wear a mask. All employees must also wear masks and gloves. Fourth, the governor must commit to obtaining and implementing a reasonable population-based testing, statistically rigorous sample. And finally, commit to an ongoing assessment. Now, having said that, basically what you're doing is balancing the expected harms. Remember that it's hard to restore social distancing once the economy opens. There will be a lot of pressure from the public, from businesses, from people who are out of work, and suffering. And I'll come back to that in a minute. It's very important for public health to recognize the harms, the economic harms that people who are out of work face, who can't make their rent, who have trouble paying for groceries, utilities. We need to keep them in mind and weigh those harms against the potential lethality of reopening business, and particularly for the vulnerable populations. It might be helpful for public health to think about innovative ways of protecting minority and other vulnerable communities, hence the importance of health equity. So let me move on to our third scenario. If I can, there. Those of you who are familiar with the Flint water crisis will recognize this one. It's a little off topic, but I think it illustrates something about the role of public health in crises, in public health crises. As you know, the city of Flint was in fiscal distress. An emergency manager was appointed with unilateral authority to decide all questions of policy, including the decision to switch the drinking water source from the Detroit River and source to the Flint River. Everyone knew that the Flint River was probably contaminated. In fact, General Motors, the largest employer in Flint, in the Flint, Genesee County area, pulled its plant off the water system. Because of the way Michigan's emergency management law operated, the health officer, the county chief health officer in the county, had no authority to override the decision, but still there were implications that affected public health throughout the county. So what action, if any, should the chief health officer take in that kind of situation? And by the way, an alternative scenario would have been with regard to the Legionella outbreak at McLaren Hospital. Should the state have notified, or the local county health department notified the public of the Legionella outbreak, that has consequences too. If you issue too many warnings, the public gets alarmed and they stop paying attention. So one of the factors to consider if you're the health officer and you don't have direct authority, as Denise outlined before, you don't have the power to act, but you still have responsibilities to the community. You have to think about the health consequences of that switch to the river when nobody else was really paying adequate attention to it. One really important factor is that you must retain the community's trust. To this day, I think there remains a lot of distrust between the Flint community and the health department, because it did not take direct action, nor did it use the bully pulpit. As with the decision to make a recommendation to the governor or support the governor, there are political implications if you if you criticize the emergency manager. It may cost you your job. My view is that to protect the community, you must use your bully pulpit. You have broad authority in almost every state to take action of some sort. No, you could not have altered the switch to the Flint River for the water source, but you could have made it very uncomfortable for the state, for the politicians, for the public, and adhering to your basic responsibilities to the community. So my sense is the two scenarios I've gone over are very different. One, very clear use of the bully pulpit. The other is a much more difficult balancing act that you have to undertake. So in the should I, and which is really where most of you live, most public health, the hard decisions are where you have a lot of discretion and the action to intervene is not clear. Just to summarize, consider the facts, the public health principles, what tools you have, how the law would support the action, and yes, be able to articulate, be able to justify and explain to the community why you're taking action. Show that you've weighed the alternatives and that you're not being arbitrary or capricious. Rather, you're upholding the best traditions of public health practice to protect the community from threats to our health. And with that, I'll just conclude by saying there may not be any easy answers to these questions, but there are a lot of choices. And those of you who are in the field, who've been doing this for a long time, know how hard it is. And with something like the coronavirus, where we have basically an economy that's shut down, while many people are suffering with terrible symptoms and death, the choices are difficult. Thank you very much and look forward to your questions.
Thank you, Peter. At this time, we'll start the Q&A. This question is for you, Denise. What is our liability for canceling large public events for health and safety, with the consequence of costing government, nonprofits, and the local economy large amounts of money?
Peter, I think you're our liability expert. I'm going to kick it to you.
Thanks. That's very kind of you. The answer, right. The answer is, I suspect, twofold. One, there is potential liability, but many contracts will have what are called force majeure clauses, allowing the contract to be canceled for circumstances often called acts of God, tornadoes, hurricanes, earthquakes, and the like, and in this case, the spread of a lethal virus, to cancel it. In addition, when you're operating under emergency declarations where the economy is shut down, I think you have a pretty good defense to say, I could not comply. There was no way I could comply with the arrangement, and therefore there shouldn't be any liability. One of the things that's going on is a debate over whether the liability standards need to be amended to take into account the crisis, having new crisis standards of care. Most courts will certainly, even without official guidelines on crisis standards in any given state or in the profession, will have already issued rulings that take into account the operation of Good Samaritans and reducing liability for all sorts of dangerous situations.
Peter, another question. How can health departments...
I was going to add to that. This is Denise. I was just going to add, and thinking about what is the liability of public health or the governor because of all the great financial losses and the impact on individuals. Generally when you take actions to protect the public's health, there's governmental and sovereign immunity and those sorts of things. But yet government has an important role in balancing benefits and burdens. And how are we structuring our society in order to, people in the service industry are the ones who are particularly suffering. And how do we provide sick leave? How do we provide medical insurance? How do we provide all of those things so that the people who are making the sacrifices and are also reaping the benefits that people like me, at least currently, enjoy because of my kind of job. Sorry, I'm done.
Oh, no problem. Peter, how can health departments and other health systems support community-based organizations, specifically syringe service programs and other harm reduction programs in crisis planning and response?
So I think there are a couple of ways to approach this. One, this is what public health does. There are any number of examples of public health departments getting very involved in opioid issues, working with law enforcement, working with community-based organizations, and other individuals in the community to develop a community-wide response. With regard to the coronavirus, right now, everything's more difficult because we're all sheltered in place, or most of us are sheltered in place. In communities where you have a so-called backbone organization, for example, in Michigan, in Ann Arbor, we have the Washtenaw Health Initiative, which is an organization that serves the community with participation from virtually every sector of the community, all nonprofits, philanthropic organizations, the healthcare systems. When you have an organization like that, it can be a conduit for disseminating information, can be a way of blanking on the word I want, never mind. A mechanism for convening virtually all of the players that you would need. And third, you have the opportunity for health departments to use their websites. And finally, community health workers might be able to work with community organizations. I would also suggest working with elected officials, county commissioners and other elected officials to resolve the issues.
Denise, can you please discuss personal privacy and data sharing, concerns with state surveillance, and how to balance the need for public health protections with consumer privacy, health data privacy, and ways to maintain public transparency through this?
Okay, that's a hard one. Could we go to slide 12 that has the ethical considerations? Yeah. First of all, there's various laws that have to be reviewed and accommodated, and looking at the exceptions for those laws about what can be shared with whom for what purpose, and where is the risk of de-identification or the risk of re-identification of information that's de-identified, those sorts of things. What I'm discovering and talking to my colleagues is we're really on a continuum of how we balance individual privacy with public health transparency and the importance of the public needing to know much more information than some health departments are comfortable sharing because of the privacy implications. And I had mentioned before the fidelity that we're not only keeping faithful to the community's trust, but we're carrying out the responsibility that they have provided us with, and we're keeping people informed of those responsibilities, and that's as much part of public health practice and response as it is to do surveillance and contact tracing and all of those other things that are that public health has been provided the right to do under either specific laws or general laws. Peter, this is such a difficult area. Do you have anything to add?
No, not right now. I think you laid out the basics. What we might do is try to put up a Q&A on our website and go into this issue in greater depth. And then we can...
And that reminds me, we have addressed a lot of issues about first responders, about releasing information to the media, and lots of other data issues that are on our website. A lot of the issues are under the FAQs, and then there are some articles that are going through scenarios and discussing specific issues that have been brought to our attention.
Okay, Peter, what kind of liability protections exist for nurses who may be practicing out of scope during the pandemic or caring for an impossible, unsafe number of patients?
So that gets back to what I was saying before. So the first part is a little easier to answer, and I think there is no liability. I don't see a situation where courts are going to impose liability under those circumstances. The second part is much harder in the following sense. If we're in a non-public health emergency, staffing levels have been an ongoing concern among nurses in particular. And I don't know how much litigation there is on it, but a lot would depend on what guidelines have been issued. For example, California promulgated staffing ratios as a matter of regulation. If those ratios are ignored, then there's certainly a chance that the hospital or health system could be held liable. If they're not, it's going to depend on all sorts of other factors that I don't think we need to go into now. But in an emergency situation, courts may be much more deferential to the providers, the hospitals and nursing homes and health systems, saying that you have to take into account the circumstances under which these decisions are being made. Now, where you get into all other issues is where what we've seen is some institutions furloughing or terminating nurses and physicians who protest the conditions. It seems to me one could argue in that scenario, the hospital is exposing its workers and its patients to greater harm when it terminates or furloughs employees when it knows or should know that they would otherwise have a shortage. I don't know. I honestly don't know how that's going to come out. There's one other aspect to this in regard to what Denise was mentioning earlier about regarding practitioner and public health practitioner liability. Most states have provisions, as Denise mentioned, for immunity. Immunity can be waived, but only for wanton and willful misconduct, essentially gross negligence. I don't see gross negligence being applied to the nurses who are overwhelmed. I don't know how they could be accused, any individual nurse could be accused of gross negligence under the staffing conditions the question mentions. Therefore, I don't see in reality much liability.
Okay, Peter, another question. How do you encourage good decision-making when the COVID pandemic is unprecedented and thus some of the tried and true public health responses to epidemics are not appropriate now?
Thank you for that question. It's a really important one. So I think we have to approach this in a couple of ways. One is through messaging, and I'll come back to that in a second. And the other is just closely related to say that social distancing, in my view, is key to reopening the economy. As I was alluding to in the first scenario I covered on advising the governor, if you want to reopen the economy, we have to have some assurance that people are being as safe as possible. Otherwise, no one's going to come out and patronize the stores, the restaurants, etc. So social distancing is the key. Reasonable risk is okay, but the fear of exposure is also very legitimate. So let's start to focus on shared values and interests in ending the virus. So even if you don't think it's real somehow at this point, I find that unimaginable. But if you think you're immune, invulnerable to it, think of others. From the public health perspective, provide demonstrations and constant reminders about how to implement social distancing, why it's important, acknowledge that it's going to be around for a while. We're not going to be able to eliminate or maybe even limit the practice of social distancing until there's a treatment or vaccine available. And here I think it's important to collaborate with the private sector, with employers. They should be as committed to social distancing as we are in public health. This gets to the broader question of messaging. And here I want to refer you to the excellent work that my friend and colleague Gene Matthews and his colleagues have done around messaging. He has developed a coronavirus worksheet around Jonathan Haidt's moral foundations theory to develop public health messages. And we will send around, we'll be posting his work on our website. It's not up yet, as I understand it, but we will send around the link and a copy of his materials. But I want to, because you'll be able to read these, I want to cover a couple of different things just for you to consider. The first is we have to listen. What are the community's objections? Why are people not engaging in social distancing? What are the underlying values that are animating that resistance to the social distancing? And then we've got to craft messages, and this is where Gene's work really becomes important. Compassion, we have to understand and show empathy for their suffering, for their economic harms, and acknowledge their concerns. And we also need to show humility. That science doesn't have an answer. We don't have a treatment. We don't have a vaccine. We can model the spread of this with and without social distancing, but models are just that. They function based on their assumptions. They have to be adjusted constantly to reflect emerging data. So the public health message has to be consistent and continuous. It's got to be like a political campaign using public health tools. We've got to enlist community leaders and physicians, nurses, community organizations, employers. I would focus on 3 primary themes because the public's not going to pay attention if we lay out 4, 5, 6 different things. So really, what are the 3 key messages that you want to convey to the public about social distancing? Well, I'm pathetic at it. Most people in the world use social media. I'm barely able to get the slides up on the screen. But social media should be a tool. Your websites should be an important tool. And we have to reflect the reality that simply some segments will not comply. The demonstrators in Ohio and Michigan probably aren't going to comply, but they're a small minority, and we want to keep it that way. We want to focus on the persuadables. How do we get them to comply? And here, to me, the biggest tool we have is that this is about harm to others. It's about protecting your communities. If you may think you're invulnerable, I'm not. Others aren't. Your grandmother isn't. Your older aunt isn't. Your parent isn't. And by the way, you aren't either. So I'll leave it at that because there are probably other questions.
So this question is for Denise. What are some legal issues schools might face as a result of the pandemic?
That's a good question. I think I first think of it currently and upon reopening, and we've seen in the media a lot about schools' responsibility for providing an education and also schools' responsibility for providing accommodation or facilitating education of individual students with disabilities, and the challenges with the digital divide. I know that my great nephew, just as he didn't have access to a computer, the school did provide him with a tablet, but then he didn't have Wi-Fi, and so he ended up, going somewhere else, exposing himself and his family. So that's been a big issue of how we solve the problem of the digital divide. When the schools open up, the schools have a legal and ethical responsibility for protecting the safety of their students, their staff, their volunteers, anybody who is on the premises, and they need to provide effective education in a safe environment. So how to implement their own standards in addition to any public health standards in order to accomplish education in a safe manner. I had mentioned students, I think I had mentioned the legal responsibility to provide and meet the needs of students with disabilities, but there'll also be issues around privacy and FERPA. And, it's issues about when to inform other families within a school community of the potential of exposure. That often happens now with measles or mumps or other infectious disease. But also, FERPA is way more restrictive than HIPAA is in providing information to public health agencies. There are some provisions about that permit identifiable information to be shared with public health. If there's a health or safety emergency, that may come into play. There may be other ways where public health is assisting the school to carry out its mission in a safe manner, and there are provisions in FERPA that would allow that kind of sharing. There are provisions about sharing information that's called directory information, school students' names and addresses and telephone numbers and those sorts of things that a school, depending on, there's a lot of exceptions, of course, would be able to provide to public health. So those are the ones that come immediately to mind.
Peter, this will be our last question. Community health workers fulfill an essential and trusted role in community health care. How are they being factored into the gathering and dissemination of pertinent information regarding the COVID-19 pandemic?
This will be a quick answer. I don't know. I suspect that it varies considerably from community to community. That's a good question, and I'll follow up and get an answer. But I don't know. Denise, do you know?
Not off the top of my head.
I would say that community health workers can be an effective conduit between, or among, I should say, the health department, the health systems, and the community. And if they're not being used, I would encourage all of us to look into how we can use them to reach our communities.
Thank you, Peter, and thank you, Denise. At this time, I'm going to turn it over to Charles for closing remarks.
Thanks, Kayleen, and thank you again, Peter and Denise, for presenting today. Just a few final notes to all of our attendees. If you submitted a question that did not get addressed during the Q&A session, don't worry, we'll be reaching out to you to make sure that your question gets answered. Also, attendees will be receiving an email from the network with the video playback of this webinar, as well as a link to our brief webinar survey. The survey takes just 1 minute to fill out, and it provides us with some great insights, especially in regards to what topics you might be interested in for future webinars. We'll also include a link to our colleague Jean Matthews' work on messaging and COVID-19 in that email as well. And finally, view the network's collection of resources on the COVID-19 pandemic and stay up to date on our upcoming webinars by visiting networkforphl.org/COVID-19. That concludes today's webinar. Thank you all for attending and have a great rest of your day.